it's 4:30 now here on this Wednesday. It's Brian and Kenna with you. Hi, Kenna.
Hello there.
How's it going?
Good, thanks.
We've got Samantha Probst with us today, and did I say that right?
You did.
Did I say okay? We talked about this before we went on, and I was like, now is it? There's three different ways to pronounce Probst, and Probst. Yeah. So, all right. Well, you're from St. Anthony Hospital. You're the speech pathologist.
Yes, I am.
Yeah. Now, if people don't know what that entails, what does that entail? What is that?
So speech therapy looks at a lot of different things. We serve both the pediatric kiddos and adult populations.
Okay.
So our scope of practice is pretty broad. We can look at things such as, articulation and how well, let's say, kiddos say their sounds, all the way to adults for swallowing, speech, how well they communicate and understand, and also their voice. So lots of different things.
Yeah. Now, you can probably help us out probably here.
Sure.
I mean,
We can give you some voice therapy if needed. Yeah.
We could probably use some of that
Actually,
sometimes.
that happened to me. I had nodules on my vocal cords and
Oh.
had to have speech therapy for a while.
Oh, wow.
Yeah.
Okay. Now, you've been doing this a long time?
About 5 years this spring.
Oh, wow. Okay.
Yeah, not as veterans as our other staff at
Uh-huh.
St. Anthony's. Yes, they're quite experienced. Yes.
Yes. Okay. Well, now, as far as you mentioned that you help the kiddos out with that, and you can do, I guess, other folks, like you said, the older folks too. If someone needs something to help out, you can do that too, I guess.
Yes. So typically how our services get started for the adult population is usually something changes in their life dramatically, whether it be a stroke, whether it be such as Kenna, who has something noticeably wrong with her voice, and she's wondering if she needs to get it checked out, or also even like such things as a traumatic brain injury, such as a car accident or an accident on the snow. We can help any kind of situation that they occur for adults. Yep.
Okay. Now, what should we be looking for when?
Yeah.
What are the red
flags?
Yeah.
Yeah. So let's just kind of focus on red flags for speech first.
Okay.
Sometimes, after a stroke or just once someone gets home from the hospital, their speech can be a little slurred. They may have sound like they have too much, one type of, it's called dysarthria. It means weakness of the muscles of your mouth. Sometimes they can sound as if they had a little too much to drink, right?
Oh.
We get a little
Slurry.
yeah.
And so we're just not articulating very well, not pronunciating. So we can work on strategies to help adults overcompensate for that. And then also, let's say someone were to have a stroke, we can help with their understanding of language, following commands, directions. We know you guys have heard a lot of physical therapists talk throughout this segment of St. Anthony's coming in here. So physical therapists have to have speech therapy on board at times, because if they are asking a patient to do a direction for, physical therapy, and they're not understanding, how are we going to progress in physical therapy? So sometimes speech therapy kind of gets on board for that. And then also just communicating wants and needs. Sometimes patients say commonly, I have it on the tip of my tongue, I just can't think of the word.
Yeah.
So we kind of work on strategies for that. But I would say one of the largest populations for adults right now that we see is what's called dysphagia.
Okay.
It means difficulty swallowing. So as we age, very commonly, we have difficulty swallowing, and we can do several different things for that to help improve the swallowing muscles to avoid risks of pneumonia or other kind of severity respiratory concerns.
Wow, you don't think about that sort of thing,
Not
I guess.
at all.
Yes.
You're totally concerned about your voice, and you don't think about swallowing.
Yes, so that is a kind of a hidden, but yet one of my passions for speech is swallowing. Very commonly, I used to work for a sister hospital before I came to St. Anthony's recently, and I would always walk into patients' rooms in the hospital and say, hi, my name is Samantha, I'm a speech therapist, and I'm here to assess your swallowing. And they're saying, swallowing? I can talk just fine.
Yeah.
So, we kind of have a hidden tool in our toolbox.
Yeah, as I say, it's something you don't think about, I guess.
Yeah. So common red flags for swallowing would be, let's say someone is swallowing and they constantly cough after they take a drink of water.
Okay.
Or if it's just intermittently a cough, that's kind of a red flag. A lot of throat clearing, even watery eyes or runny noses. Those can be indications of possible what we call aspiration, where food and liquid go down the wrong way. We've all experienced it.
Yeah.
I'm sure, Kenna, you have.
I have,
You have as well. And we're like, whew, that went down the wrong way. But we don't want that to happen too often, because it can lead to, like I said earlier, pneumonia. So we want to avoid that.
Okay.
Yeah.
Now, if I'm having issues, do I need a referral from my physician?
Yes. So typically what you would do is go to your primary physician and just kind of explain the concerns, and they would write an order to speech therapy. If they sent it to St. Anthony's, we would see the diagnosis most likely for dysphagia, which means difficulty swallowing. And then pending on our concerns, we could do we could call you, schedule you for an appointment. We're located at the Workman Center. And then if we have further concerns, we then can do what's called a swallow study. We would then call and contact the physician for a follow-up. But basically that test is done also at St. Anthony's Hospital with a speech therapist in the room. And we give various food consistencies, but it's done within the radiology department, so we can know specifically if something were to be entering someone's airway and know exactly what's going on with the swallowing structures.
Oh,
so,
excellent. Yeah, so it's a great way to see, I guess.
Working together, too, to come up.
Yes, and then, therefore, we can then, after the swallowing study is completed, and if there were to be aspiration, yes, sometimes diets have to be modified just to make them safe to eat and drink. And then we would then create a plan of care for treatment, and they would follow up at the Workman Center with us.
Okay. All right. Very good. So, yeah, you brought up a lot of good points and a lot of things you don't think about when you're talking speech therapy. I mean, that's you don't think about swallowing.
Just thinking about enunciating and things like that.
Yes.
This is totally a whole new ball game there.
It is, definitely. Yeah, something you just don't think about now. If people want more information, can they contact St. Anthony's, I guess?
Oh, absolutely. We have 4 speech therapists on staff, so if we have any specific questions related to that, we definitely can answer any questions that they may have and any kind of routes that they may need to go before getting referral to come see us. Yes, absolutely.
That sounds great. Well, Samantha, thanks for stopping
so
in and
much.
talking to us today.
Yeah, no problem. Thanks for having me.
Very interesting, always. These are great.
Yeah, they very much are. That's for sure. I learn something new every time that someone comes in and talks to us and stuff. So,